one of our unexpected tasks, having started as an SEO shop in '96, was, content was king. Even back then, they didn't call it content marketing. It was just, the engine that drove SEO. And, part of the big task was figuring out how to get buy-in within all the channels of the organization, from customer support people to salespeople, et cetera, to co-create content internally. And has there been anything that has helped you? Because I'm sure that there's just wealths of information within your clinicians, right? But they're busy, right? And so content
Yes.
creation isn't on their to-do list, or at least wasn't in the past. Have you been able to sort of find a carrot or stick that gets them excited about content creation or content co-creation?
It's been the carrot, and you're right, because they are so busy, and that it's not their favorite thing to do. But what we do is observe trends, and you can tell by just looking at Google Analytics what topics are trending. And if we find out that valley fever or Lyme disease or something is trending, then that's our signal to go to them and say, hey, there are X million viewers that are looking at Lyme disease content. Can you please give us 20 minutes of your time? And then we're much more likely to get the interview from them or get their time, because they know that if they put something out there, that will get traffic and they will get exposure.
Have you found that some of them have their own social media profiles, and you can sort of tell ahead of time that they're going to be either more charismatic or just more clear in their content as they produce it? Does that sort of guide you internally as you find your subject matter expert when Lyme disease is hot?
Well, this interview is going to be publicly available, so I'll be diplomatic and say, let's just say we know we definitely have some very articulate, very comfortable in front of the camera, media ready physicians, and we have some who are less comfortable doing that. So we try not to go back to the usual suspects are often tapped over and over again. We try and branch out on those. We typically don't have a lot of people with independent media presences, but we try and constantly be chatting with people who are there's some people are just that way. They just enjoy public speaking, and if we can find them, we use them.
Yep, yep. Have others asked for essentially media training to make them better at it?
They have not. If they're not good at it, they know it, and they really would rather not participate at all.
Okay.
We have found that if we boil it down to a formula, and if they know that they're not going to have to ad lib it, and we find that if we bring the video team to them, and then if we have a skilled interviewer, so they're answering questions, one, they're much more likely to be spontaneous. They're not reading a prompting card, and they're much more comfortable. And if we can say, look, we'll get you in and out in 7 minutes, you'll have somebody there, easy peasy. And we typically send them a couple of clips of their colleagues who have had interviews, and they look at it and say, oh, I can do that. If it's a question mark or they don't know what they're up to, they think it's going to be a 60-minute segment, then we don't get a good response. But if they know, oh, I can do this, this will be quick, they're pretty comfortable.